Ayurveda. I am Dr. Kalpani Piyatunga, attached to the Department of Indigenous Medicine under the Colombo Municipal Council. Today I wish to discuss with respect to application of Ayurveda for Covid-19. Basically speaking, Ayurveda means the science of life, which explains about living a healthy and a happy life. Uh, in this module, we wish to explain with respect to how to improve your immunity and how to control and combat this disease condition during the pandemic season. Application of in the sense of application of Ayurveda for COVID-19, we wish to discuss from the illness how you can go through wellness in order to achieve the happiness. So the prime objective of Ayurveda is to protect the health of the healthy person and to cure the sickness of the ill person. So in order to do that, we need a diet plan and a well sound sleep, which will enhance the immunity. And there are certain strengths which we have identified in Ayurveda, mostly the cost effectiveness and the quality, safety and efficacy of drugs. It's all time tested for more than 3000 years. Then for the preventive treatment and restoration care in Ayurveda, there are certain strengths which we have identified, like immunity boosters and yoga exercises, especially for immunity boosting purpose, Panchakarma treatment for biopurification purpose, and rejuvenative drugs for restoration purpose. Epidemics in Ayurveda is explained in authentic textbooks. Janapada Udvansha Roga is that is in Charaka Samhita, which explains about which diseases that affects the entire community, and Aupasargika Roga, which is mentioned in Sushruta Samhita, which speaks about communicable diseases. Now, first and foremost, I wish to elaborate on the immunity promoting measures that can be adhered during this quarantine period, where your travel is restricted and where you are quarantined and refrain to a certain limited space. There is Dinacharya and Ratri Charya, which is explained in Ayurveda as a daily regime and night regime, which can be adhered very easily. Now, Dinacharya is one of the desired good health and good health practices that if we have to adhere if we wish for the betterment of life. Now, firstly and foremost, the emphasis goes for waking up early in the morning. That is called Brahma Murti in Ayurveda, which is about 4:45 a.m. So the person needs to wake up early in the morning in order to manage household work and to organize the lifestyle and everything. And drinking lukewarm water, which is called Ushapana. That is very much essential in order to facilitate evacuation of stools and urine, which I have identified as one of the major problems which are faced by the urban community due to constipation. Now, brushing teeth, that is being emphasized as Danta Davana in Ayurveda. It will, because almost everybody does it, but it is specially mentioned in order to maintain the oral hygiene during the pandemic season. So Danta Davana as well as tongue cleaning, that is Jikva Nirlekana and Achamana, which is massaging the gums, that will help to alleviate the gum diseases and to improve the circulation. Then gargling the throat, that is through Kavala and Gandusha, which is explained in Ayurveda, is very much helpful in preventing the increased growth of viral flora. If it is not possible, at least using lukewarm water, which will reduce the odor, bad odor in the mouth, and which will improve the lightness of the oral cavity, and that is very much essential during this pandemic season. There is one more essential thing that Ayurveda have already explained, which that is called Prayogika Dhumapana, or the herbal smoking, which can be executed on daily basis. So it will be much handy during the pandemic season, because since COVID-19 is upper respiratory tract disorder, where if you have access to some citrus leaves, it can be used to inhale the vapor. Physical exercises, of course, is very much essential in order to improve the immunity. That either if you are much aware of it, you can do either Surya Namaskar in the morning or Chandra Namaskar in the evening, or even taking a deep breath, that is called pranayama exercise. That is very much essential in order to maintain a good health as well as to boost your immunity. If the patient is having a sedentary lifestyle, or if having COVID-19 complication such as COVID-19 pneumonia condition or any other secondary complication condition which will restrict the movement, so in that case, at least performing Tai Chi exercises can be very helpful for his recovery, as well as to prevent further aggravation of the disease condition, and to improve the health, and to go to having a bath before meals is essential in order to boost the digestion. And we should, because most of us used to have a bath after meals, which will affect badly for the digestive condition. And now when it comes to bhojana, that is the major part which a person should be concerned with respect to improving immunity. When it comes to bhojana, Ayurveda explains drinking herbal tea can improve the immunity at large. So cinnamon or the cardamom, or even turmeric can be used for herbal tea basis. Even Ayurveda explains about golden milk, which if I explain it properly, so the golden milk is use of turmeric powder with milk, that is half a teaspoon of turmeric powder needs to be added to 150 ml of fresh milk, and it needs to be boiled, and that is called golden milk, which can be used as a substitute in order to improve the health during this pandemic season. Then having 6 hours of sleep, that is very much essential. It should be undisturbed 6 hours of sleep, which will greatly enhance the immunity. So in that case, what we can do is we can do a little bit of meditation before going to sleep. Then because for today, of course, I wish to discuss only with respect to these